Hello everyone. Welcome back to our OCT series public lecture. Today, let's take a look at aspects related to measuring OCT images. Now let's look at plaque-related measurements. For plaque measurement, key parameters include fibrous cap thickness, which is crucial. Fibrous cap thickness is a key determinant in classifying a plaque as vulnerable or non-vulnerable. It's a very important factor. A thin cap fibroatheroma refers to a fibrous cap thickness below 65 micrometers. Besides, its lipid core occupies 2 or more quadrants, as we mentioned previously. This is just a review. We also measure lipid arc length and its angle. This is the illustration for fibrous cap measurement. As mentioned before, fibrous cap thickness is measured at the thinnest point, adjacent to the lipid arc. Points A and B here measure about 60 and 70 micrometers respectively. This indicates a very thin fibrous cap. The right image shows the same way. In addition, we measure the lipid arc, area and its length. The lipid arc angle is measured from the start and end points of the arc, approximating a circular segment's curve. The outer circumference is used for assessment. Besides this, we can measure the area of the lipid pool itself, its specific area, for evaluation. Some physicians prefer assessing the angle size, but as mentioned before, the angle is highly dependent on the chosen center point. If the center is closer to the vessel wall, the angle appears larger. If it's farther away, the angle becomes smaller. Therefore, this measurement is very subjective and has poor reproducibility. Thus, it's essential to master the first two measurements, length and area. The third aspect is about lumen measurement. Regarding lumen measurement, it primarily involves measuring the lumen area and the diameter, these two aspects. Now for measuring the lumen diameter, everyone can see. Here it is. Generally speaking, the vessel diameter is usually not a perfectly regular circle. Most are elliptical in shape. So during the measurement process, we still try to measure a long axis and a short axis. For these two acreus, the diameters are 1.8 and 1.3, respectively. This is a relatively small vessel. On the right, it's 1.67 and 1.0. This is also a relatively small vessel. Besides measuring these, we also need to measure the lumen area of the vessel. On this Chinese OCT system, or other machines, there are corresponding measurement methods. This for us, using ultrasound to measure valve orifice area, etc., is similar. It's based on an anatomical area. We outline it by using dots. Of course, most machines can sometimes automatically identify and measure it. After identification, we only need to check if the result is accurate and drag these small points for fine-tuning to obtain a relatively precise lumen area. Following is about measuring lesion length. For lesion length measurement, generally speaking, the machine can automatically generate it. Look, we have a lesion in the left anterior descending artery. After completing the procedure on this patient, it can define the proximal normal reference segment and the distal relatively normal reference segment. The length between these two is defined as the lesion length. If we zoom in and look, then actually, you can drag this middle line to review the identified distal and proximal ends of the lesion. See, the identification is very accurate. It effectively avoids the so-called plaque and intimal rupture areas. Therefore, when we place stent, we generally go from normal vessel to normal vessel. Try not to place them on vulnerable plaque or areas of intimal rupture. So, this is why OCT can provide us with relatively precise data. That's all for today.